We are
Yeah, you'd
live.
have to reload. It's okay.
No, that's fine. We will do like this.
Perfect.
Oh,
Okay, great. We are live. Our attendees are joining. Welcome, everybody. We'll give everybody a few minutes to join and get settled for the webinar. Good morning, good afternoon, good evening, everybody. Thank you for joining the Global Digital Health Monthly meeting. We'll give everybody just another minute or two to join, but feel free to say hello in the chat. Let us know where you're joining from, and we'll start in just a minute. Hi, Farhan, Tatiana, and Amanda. Good to see you all. All right, well, I'll go ahead and get started while folks continue to join. So good morning, good evening, good afternoon. My name is Christina Valella. I am one of the co-chairs of the Global Digital Health Network. We are a large community of practice of those working in global digital health across the globe, spanning from implementing partners, donors, government officials, those working in research and academia and the private sector, and others. And we host monthly meetings such as this on different topics that are of interest to our members, on different topics, pressing areas in digital health. We also have an active listserv, which is where some of you may have gotten the webinar notice here, but if you did not sign up, or if you're not part of the listserv or not part of the network, I'll put that in the chat for you so you can subscribe to get these notices automatically about our monthly meetings, as well as be able to connect with our over 4,000 member network. So the listserv is very active. People feel free to exchange information, ask each other questions and things like that. And then at the end of the year, the network also puts on the annual Global Digital Health Forum, which we are in the midst of planning. So you'll be getting save the date announcements on that. So please do stay tuned for that. So now I'd like to introduce our panelists for today, or actually our host organization for today. So MSH is hosting today's monthly meeting, and they'll be talking with us, sharing lessons learned and the work they've been doing in digital tools for pharmaceutical systems, which is a really, I feel like a very timely topic given just how the pandemic has kind of had to force us all to look at how we can improve our information systems and track vaccines, but as well as other treatments more tightly and efficiently. So really looking forward to this topic. I think it's a topic that we haven't heard as much about through the network. So without further ado, I'm going to hand it over to our moderator for today's session, Randy Wilson, who is the Digital Health and Data Analytics Practice Area Lead for Management Sciences for Health. So Randy, over to you.
Great. Thanks a lot, Christina. And good afternoon, good morning, whatever time it may be for those of you who have tuned into this interesting presentation. I'd like to just introduce the panel of speakers who we have today and walk you quickly through the agenda. Just in terms of housekeeping items, we're encouraging you all to ask questions. We'll try to keep our presentation reasonably short so that we'll have 20 to 15 minutes towards the end of the presentation for Q&A. But since I don't think you'll be able to actually speak live with us, please record your questions into the chat window as we are moving along in the presentation, and I will try to go through them and assign them to the different speakers, unless you have a particular speaker in mind who you'd like to respond. Today's session is really focusing on MSH's efforts to support the design and implementation of digital tools for pharmaceutical systems, not limited to just the supply chain piece, which you will see shortly. Our speakers for today are Kofi Abagye Nyame, who's the project director for the MTAPS program, which he will explain a little bit more about. Xavier Guzman, who's our technical director for the same project. Dean Putzier, who's the MIS Senior Principal Technical Advisor based in South Africa, again with MTAPS, and Kim Hoppenworth, who's the MIS Senior Technical Advisor, also based in the Virginia area. So if I could have the next slide, please, Kim. Kofi will provide the introduction. Javier will talk a bit about the need, the problems we're trying to solve here in terms of why we need these digital tools, particularly in the regulatory environment. Then Kim will provide an overview of the different tools and the suite of tools that is evolving from them. Kim and Dean then will sort of talk together around two of the specific solutions, PharmaDex and RX solution, and we'll focus on the progress made, how those have evolved over time, and what are the future plans for those tools. So without further ado, let me go ahead and pass the baton over to Kofi. Take it away.
Thank you very much, Randy, and good morning, good afternoon, and good evening to everybody, wherever you may be. I want to give thanks to the Global Digital Health Network for inviting MSH to host this today's session. And I hope that by the end of the session, we will all have learned a little bit about some of the approaches that we have been using to try and solve this problem that we all have that has been around us. Obviously, healthcare systems, pharmaceutical management systems being part of the healthcare system definitely depend on information, and information needs to be collected as part of the routine work that we do, and it needs to be managed in such a way that we can use them to inform the work that we do. But just to talk about the organization and the project that we do before we get into the actual meat here. So MSH, as you all know, is Management Sciences for Health, or you may know, and our goal is to more or less bridge what is known about public health and what is done about public health. A lot of is known, but a lot of work needs to be done in order to attain the goals that we all want. Currently, most of us, as we said, presented this webinar from the MTAPS project, which is Medicines, Technologies, and Pharmaceutical Systems project, which is a USAID funded project. It's a 5-year project. And our main goal is to improve pharmaceutical systems in low and middle, strengthen pharmaceutical systems in low and middle income countries. Now, MTAPS is probably the 5th iteration of US government support to building pharmaceutical management systems. This is the follow-on to the SciAps program, which also followed this SPS project, and then RPM Plus and RPM project. And so USAID has been very much working in this space of building pharmaceutical systems all this while. MTAPS currently has 5 main objectives, and we work in pharmaceutical systems governance to ensure that the policy environment, the legal environments are all in good shape to support pharmaceutical systems in support of the healthcare system. We also work in building human and institutional capacity to support pharmaceutical work, pharmaceutical systems work and supply chains, with a particular focus on building capacity for regulatory systems and regulatory management and harmonization across the continent. We also focus, especially now that we're talking about tools for information, one of the areas of focus, information for decision making, and not just a focus on tools, but the decision making that the tools enable. And also ensuring that we are contributing to the global learning agenda. The fourth area of work for us is pharmaceutical sector financing, ensuring that the financial resources are used appropriately and they are optimized. And there are various ways to ensure that medicines are used, or the cost of medicines do not cause catastrophic expenditures to households, and also are not too expensive for the health system. Our fifth area of work is pharmaceutical services. So everything from making sure the product is there to making sure that the products are used appropriately, and the safety considerations, pharmacovigilance, antimicrobial resistance are all taken care of. It is my hope that we can learn a little bit from this. I mean, information management systems have always been on the radar, and this is the work that we've been doing for quite a while. In a paper that we published in 2018, we talked about some of the lessons that we learned, that indeed we need to harness the governance systems. We need to make sure that we are engaging all the stakeholders for it to be sustainable. It is not enough just to build some tools and leave them there. I think that our panelists will talk a little bit more, but making sure that these are interoperable and these are sustainable are going to be the key. So I'll hand it over to Randy, and I hope that by the end of today, we would all have learned something new. Welcome to the presentation. Randy?
Sure, thanks again. Now if I can pass the baton over to Javier, will take us through the next part of the presentation.
Thank you, Randy, and thank you, Kofi, and thank you all for being here. And thanks to the network for hosting this webinar. Data and information systems, I mean, these are essential elements when we talk about securing sustainable access to and appropriate use of medicines. And that's what we're going to talk about here. And we understand when we talk about access to medicines and we talk about the pharmaceutical system, we talk about all these different components: human resources, financing, governance, service delivery. But here today, we're going to focus on two main areas. One area is regulation, and that's basically to make sure that medicines are safe, effective, and quality assured. And the second area is supply chain, specifically making sure that there is availability of products at the point of service. And that is basically the focus of the RX solution tool that we will be presenting. So if we look at these two elements, it is important to look beyond availability, to look beyond the stock outs, and make sure that the system is in place to basically procure, distribute, dispense, and use appropriately safe, effective, and quality assured medicines. So this is our mandate, and we see this data analysis, collection, information for decision making as essential in the way we strengthen pharmaceutical and health systems. So with these two, elements in terms of the two tools and angles that we're going to take, I'll hand it over to the meat of the webinar. Over to you, Randy. Thank you.
Great, thanks very much. And I think that's really important background. We do need to really be sure that we're optimizing the use of information to optimize the use of our resources and make sure they're getting to the right people and through a system that's properly governed. Now I'll hand it over to Kim, who will talk us through the kind of overview of the landscape of tools that MSH has developed. Kim, go ahead.
Thanks, Randy. So I will just initially mention a little bit about each of the tools that MSH has developed over the time of the previous projects and the current one. MSH has been developing tools, as you can see, for a wide range of purposes. The first one, eTB Manager, is for management of TB patients and care. MSH also developed the electronic dispensing tool, which is kind of the kit to the smaller version of RX solution. And then we have also developed some quantification tools, one called QuantiV, which is downloaded in more than 100 different countries across the world, mainly focused on quantification of TB. And then the predecessor to that one was QuantiMed, also focused on quantification at the national level of all types of medicine. And then lastly, we have the regulatory authority softwares, Pharmadex, the purple one, and PVIMS, the light blue one down here to the left. And they are mainly focused on regulatory authority, pharmacy or pharmaceuticals, medicines registration for Pharmadex, and pharmacovigilance monitoring on the PVIM side. So those are the three tools we are going to go a little bit deeper into during this presentation. So again, Pharmadex for medicines registration, pharmacovigilance monitoring system called PVIMS, and then RX solution for patient management, dispensing, and inventory management. So on the next slide here, gives you an overview of where those different softwares fit into the health sector. If we start from the top left, one of the tools we will focus on in this presentation is the Pharmadex again for medicines registration. We are also looking at, during the course of the MTAPS project, to expand it into other functions under the regulatory authority, initially focusing on inspections. And we already developed a new module for import of medicines, control of import, issuing of import licenses, and so on. And then on the lower level, the health facility level, we have for the regulatory authority side, we have the PVIMS for pharmacovigilance monitoring, which is typically entered at facility level or at a clinician level. It can also, of course, be entered by any patient who is experiencing adverse drug reactions, and then it's submitted via PVIMS to the central database. So as much as PVIMS is capturing data at facility level or clinician or patient level, it is then monitored at the central level, at the same level as Pharmadex within the regulatory authority. Then after I go through Pharmadex and PVIMS, Dean will then take us through RX solution in terms of how it works and what is working and what the challenges are. So of course we have the middle layer here, where we then start looking at the interoperability and data exchange layer. We're trying to be inspired by the OpenHIE framework, and we are also looking at integrating different both software standards and like if the fire engine HL7, we are trying to also look at the standards for pharmaceutical systems, and especially with the regulatory authority, looking at WHO guidelines for both medicines registration, inspection, pharmacovigilance, and so on. So good enough, when we look at all those standards we have from WHO, if we focus on the regulatory authority now, WHO has developed a tool called the Global Benchmarking Tool. It's built from 9 different modules, and it's basically an advanced and extensive assessment tool for assessing the maturity level of each of the functions at a regulatory authority. So the first one we are looking at, the green ones here, the pieces of software under Pharmadex, or the modules that we have already developed. And the yellow ones are where we will be going or are already going. And the red ones here are the ones where we will mainly focus on developing interoperability, because for like number 7, the laboratory testing, we do have LIMS and other systems in place already, so there's no need to invent it from scratch again. So I highlighted the link down here to the global benchmarking tool. If anyone is interested in it, you can go there. There's a very detailed description of each of the module or components here. But I will just briefly take you through each of them in terms of what we are doing and what problems we're trying to solve with each of them. So here we have initially the medicines registration. So the problem we're trying to solve here is the very complex workflow that you have at regulatory authorities. You have large paper trails that leads to a long processing time, in this case, to get towards getting a marketing authorization issued, meaning that you cannot make the medicine available to the public unless you have a marketing authorization. So that's kind of the main purpose of the medicines registration software here. It's a rather complex workflow that involves a lot of different players. It starts from submission, of course, by the applicant. Then it goes into the regulatory authority, where it first screens by one staff. Then it goes to a moderator, who then assigns the people to review the different parts of the medicine application. And then eventually it goes through reviewers to the moderator again, and then eventually the head of the regulatory authority will sign off on the marketing authorization, now allowing the applicant to market the medicine in the given country. So the system we have currently is web-based, and we are aligning it to the WHO guideline on what's called the CTD, which stands for the Common Technical Document Format, which is again a standardized kind of advanced table of content, where you have the different components listed in a certain way and standardized like that. We are also including international standards like the INN, the International Non-Proprietary Name for Active Ingredients, and we are also including the ATC, Anatomical Therapeutic Chemical Index, that groups the medicines into different groups, like the group A is the abdominal, B is blood, C is for cardiac, and so on. It's also very well described on the WHO homepage. So by doing this, we are ensuring more transparent, timely, and standardized processes for the medicines registration. Currently, we are working, as you can see on the top right, we are working on that in Nepal, Mozambique, and Bangladesh. We do have a few other countries also, but we're not actively working there right now. One of them is Namibia. If we then go to the global benchmarking tool module 3, which is about pharmacovigilance or vigilance in general, we are focusing on pharmacovigilance. So regarding medicines, it's more or less the same. We have a complex workflow to look at the regulatory authority. So again, more or less the same types of issues where we don't have the data available for analysis and so on. It's also a web-based tool. We are linking it or integrating it with Pharmadex as a module to Pharmadex currently, and it's also following the WHO standardized guidelines. So when we talk about pharmacovigilance, there are other standards. We are looking at the one I mentioned here is ICD-10, which is the disease code, international code for disease, version 10. It keeps advancing in version, and then of course you can upload the next version or standardized list of diseases into the system, and then it will align with that. The system called PVIMS here is unique in performing the active surveillance, where you're looking at cohort monitoring of and looking at signal detection and stuff like that. It's some pretty advanced algorithms, and we've not yet found other tools that are good at doing that. Then let's jump to the global benchmarking tool module 4. This is now built in Pharmadex again as a module, and this one is focusing on the regulatory function of medicines import. The global benchmarking tool module 4 is expanding further into post-marketing surveillance also, but we are initially focusing on the medicines import. So the main concept here is that after you then on the global benchmarking tool module 1, the medicines registration, after you then get your medicines registered, unless it's manufactured in your country, then you would need to have you need to import, which means you need to have an import license. So of course you need that for a lot of medicines. There are certain medicine groups like narcotics where I think it's WHO who is then issuing a certain quantity that should be controlled by each country on import. So of course that's it's a challenge to then linking issuing of the certificate or the import license, linking that to actual consumption is definitely one of the challenges that we will be looking at in the future. It is also because it's integrated with Pharmadex, it's also web-based, and we're trying as much as possible to follow the import standardized procedures from WHO. Though in some cases it varies quite a bit, because it also links very strongly to the financial sector of a given government system. So there are different processes on that side that are not always standardized. Let's go to module number 5 and 6. So this is now in regards to licensing and inspection. So that's where we are looking at the GXP. So we're looking at the GXP. It is goods area practice. So we are looking at good pharmacy practice as one of the main components, which is looking at the regulatory authority having inspectors employed and trained, who will then, with an inspection tool, go to a given pharmacy or premises and do an inspection, measure them against a certain level of a certain set of indicators, and then give them either a license to operate or revoke a license to operate or renew it. So that's also, it's a simpler workflow, and we are just beginning to develop that now. We do have examples where we have developed a module to do this from other countries, but it has been country specific until now. So what we are focusing on is making a more generic international module that can be deployed in multiple countries. This again is a module developed under Pharmadex, so it's web-based, and again is built on a very good standardized workflow and guideline from the WHO. So in the end, the benefit here is that it will ensure safer and higher quality services available for the patients at the service point. So the main challenges here, as much as we can look at the global benchmarking tool and be very well aware of all the different functions a regulatory authority have, when we're talking about our MIS tools, if we don't have very strong processes, preferably SOPs, written SOPs in place, and staff trained, and have enough staff also to do all these functions, then it's going to be a tricky thing to start using a software tool. Again, the software tools we have, they support the existing functions or procedures, workflows within the regulatory authority. So we might, in some cases, need to revise those in collaboration with our regulatory system strengthening experts within the program and within the individual government, to make sure we have a strong foundation before we start computerizing or digitalizing the regulatory authority. We are also having some challenges in regards to finding the right balance between a cloud solution and an on-premise. It's always a bit of a back and forth to find out what exactly works in a given country. And again, you know, the tools we have for Pharmadex and PVIMS, they're web-based, so they will run on-premise from a regulatory authority physical infrastructure, or they can be put on a cloud. We have deployed it on both. We've tested both of those scenarios, and for Mozambique, they're deployed on the cloud, and then in Nepal, it's more on-premise type in country. So I think those are the main challenges. I will, at this point, I think I've taken enough time, so I will hand it back to Randy again.
Great. Thanks very much, Kim, for that great overview of PVIMS and Pharmadex. Without further ado, to make sure we leave time for questions, let me hand it over to Dean, who's going to walk us through the RX solution primarily. Go ahead, Dean.
Thanks, Randy. Thank you very much, and hello, everybody. Kim, if you could just go to the next slide, please. Thank you. So what is the problem that RX solution solves? So in LMICs, you have a problem with infrastructure or no internet. You can't just throw a web-based solution randomly at something that's transactional like RX solution or a supply chain management system. Because if you do that, you tend to exclude the majority of the facilities that require this kind of electronic tool. So you have to then ask the question, I want visibility, how do I do that? I want constant online system, how do I do that? So at the end, we came up with an architecture of more of a hybrid solution with RX solution than a web-based tool. So what that allows us to do is it allows us to continue transacting at the facilities should there be no internet connectivity. And then when there is internet connectivity, we submit all of the visibility data to a central point or a central repository. That repository is then interrogated and dashboards are created from that particular repository. So what that allows us to do is then give us enterprise level supply chain management at a facility level without worrying about infrastructure. It also gives us, RX solution does dispensing. So we have enterprise level patient dispensing and that allows once again the facility to continue working if they have infrastructural problems. So the whole concept of RX solution was through all of the many projects that Kofi has mentioned of MSH, SciAps, etc., and currently MTAPs. It's intended to manage medicine and medicine supplies from the supplier all the way to the patient, giving visibility from end to end. And we'd achieve that with RX solution. But also important to know is that a lot of dispensing systems that I've come across are not necessarily dispensing systems. They're more point of sale, where I'm going to talk about it later, but dispensing is not point of sale. It's a very complex procedure all on its own. It's not just a case of counting how many pills left the building. There's standard treatment guidelines to take into account, and I'll chat about that later. If you could go to the next slide, please, Kim. So what is RX solution as far as the supply chain is concerned? It's procurement, inventory, distribution, and down referral management. What that is, the down referral, let me just briefly talk about down referral. So down referral in RX solution is the ability to pre-pack medicines and take them to the patients. So for instance, in a South African context, patients come to the main facility, the main hospital, they'll get their first script for chronic dispensing, and they won't necessarily be able to travel in the future. So what the main facility will do will then say, let's pre-pack the medicines and take it to the clinic that the patient has said it's closest to them. And we've got a whole route distribution system within RX solution to allow that to take place. Also, if you look at the procurement part of RX solution, it's based on standards, INN, ATCs, ICD-10s, all of those standards that Kim mentioned, and also SNOMED. So there are quite a few different standards we have taken into account. So Rx Solution also in the stock management side works on both a push and a pull level system. So the push level means that your dispensing is calculated, or your procurement is calculated for you. So a higher level institution will then decide what kind of medicines you are needing based on your consumption at whatever facility you are. It will then pre-calculate based on the calculations within Rx Solution. We use Bayesian calculations that take lead time, lag time, epidemiology, all of those different levels into account. So what that then does is allows the facility downstream, the smaller facilities that don't have quantification capacity, to receive medicines on a push notification. Rx Solution also does the pull method, which allows in-depth calculation of stock levels. It's based, as I said, on lead times, usage, current needs. In South Africa, they have a system where at Christmas time, they do a double dispensing for chronics, for non-communicable diseases. So it evaluates the requirements for the Christmas period as well, which is a double requirement effectively. So Rx Solution also does expiry dates. It integrates with other systems. If I can just go back to the push and pull method, in South Africa, Rx Solution is deployed in areas where we have capacity. We don't deploy Rx Solution into places like a small clinic where there are perhaps 1 or 2 nurses working. They don't have the capacity to do quantification, stock levels, and stock management. So we worked with integration with a system called the Stock Visibility System, which is also known as Rx Lite. And what this does is that once a week they send to a central point their stock levels on a mobile device. That mobile device is a store and forward. So that mobile device will then, if they don't have signal, they can capture the information. And when they have a signal, they'll submit it to the central repository. Rx Solution then picks that information up and automatically quantifies what that particular facility will require at any particular time. So if you go to monitor, it also monitors expenses and budgets. And obviously that's a critical part of any kind of stock management systems. So if you can go to the next slide, please, Kim. This is just a brief idea of some of the kind of reporting that you can get, graphs reporting that you can get out of Rx Solution based on ATC classification. This is a value-based classification of a facility back in 2010 here in South Africa. So if you can go to the next slide, please, Kim. So what does Rx Solution do dispensing-wise? You can set up and configure products. You can capture patient information. So what we do is we capture things like visits, lab results, weight and CD4 count, viral loads, adverse drug reactions, which we're planning on integrating at some point with our PIVM solution. And then there's also things, adherence, for instance, where we can capture patient adherence. So a very crucial part of what we have in the dispensing facilities as well is standard treatment guidelines. What is critical for this is that we can then allow nurse prescribing to be conducted in those clinics where we can allow the patient to present with an ICD-10 code, and we've got a limited set of standard treatment guidelines if a patient presents with hypertension or whatever their condition may be. The nurse will then just select one item, and all the products are then allocated into the dispensing system, and they are pre-labeled, and the whole chronic dispensing route is then allocated. So when they come back for a second one, that second visit for their next dispensing, that is already in the system, and it's ready for them to be dispensed. So labeling is also configuration, but we do have, and if you'll go to the next slide, Kim. you will see here where we can produce reports on those standard treatment guidelines. You'll see this is a report in 2010 on HIV protocols, where new protocols were phased in and old ones were phased out in a particular facility. And we could see and track exactly how the phasing in and the phasing out was going. So we have a substantial set of reports that we can build from all the dispensing in Rx Solution. If you can go to the next slide, Kim. So Rx Solution was developed by MSH, as Kofi has mentioned, in all of our projects, and it was primarily developed in South Africa. It is, however, hosted in 2 countries at this moment. There's approximately 700 sites in South Africa that use it. Over 80% of all the major hospitals, public sector hospitals, are using it. There's almost 300 sites in Uganda that are using it. As you can see, that there's almost $1 billion worth of medicines are processed in South Africa every year through the system, and that data then gets managed centrally, and it allows for a national procurement unit to do quantification and alert suppliers as to what their needs would be each year and each following year. So Rx Solution also won a Public Sector Innovation Award in 2013 in South Africa for automating all of these procedures, and we're very proud to know that it did win this award. And it wasn't just in healthcare, this award, this was all public sector innovation, and we were the top in the health sector innovation. Rx Solutions also been through many security and financial audits. Due to its high visibility, it's been scrutinized top to bottom. So we're very pleased to know that it's been successfully processed through all of these audits as such. If you can go to the next slide, Kim. So what are we doing now? We're focusing very much on international versions, making them not country specific, ensuring that they can adapt to any national situation that is out there, and we can deploy easily and with just a little minor configuration and making sure that the systems are working. We're building on global standards, both pharmaceutical as well as information systems. We're looking at systems such as FHIR, HL7, IHE, and all of those international standards that are out there. So we're looking to integrate where possible and sensible. As mentioned, we've already integrated in South Africa with tools like SVS, and we're looking to do other integrations where we can see a sensible sharing of information with other systems. And the focus is on sustainability and handover. In South Africa, MSH has successfully handed over, and Uganda, they've both been handed over, and Rx Solution, and these tools are surviving all on their own at the moment. There's been no active support for them by MSH at this point. The countries have taken ownership and are building the tools, building on the tools and building on the processes themselves, and they have a life of their own. Key though to all of what we do is we're open source, and all of the tools are available on GitHub, and they can be downloaded, and we are available on, you can contact us via the GitHub contact mechanisms through email, etc. So we are available there. Thank you very much, and I'll hand you back to Randy for.
Great. Thanks very much. It's time for, I think we've timed things just right. It's time for question and answers. I don't see a lot in the chat. I had, while people are thinking of questions to ask, I had one question for Kim around the licensing and inspection tool. Are those being designed also to be available for tablet or mobile data collection? Because it would seem quite essential to be able to collect data kind of in the field when you're doing those pharmacy inspections.
Yes, it's part of the thought process. As I mentioned, we do have a few country-specific ones. One is from Uganda, and the data collection tool was designed so it can be used on a tablet via a simple radio button. We don't have a specific app for it, but moving forward, we might be looking at having a specific app. Otherwise, these days, you can customize home pages to look nicely on a web platform also. And we have done that with PVIMs, which also works partially offline with a cache on the given device that you're running it from. And then when it's again like with our solution that Dean talked about, when it then connects to the internet, it submits the data that has been entered.
Great, thanks a lot. We have a question from Farhan Yusuf. What about private sector pharmaceutical outlets? Do you have digital tools to get that data? I wondered who would like to take that on.
I'm happy to take that one. I think the complexity from private sector comes in that they are private pharma and they are not always that keen to share their information with public sector. We with Oryx Solution and the central repository have it's an API, it's cross-platform, it's anyone can submit data to it. We just need to, if they ask us for access to the API, we'll happily share our API with them. The standard is, the format is standard, and that data can then be shared with any dashboards that the public sector are preparing.
I can also contribute to that one. So in Uganda, it was actually initially the private sector who started using Rx solution, the private not-for-profit. So those are the faith-based organizations, and they have a central medicines warehouse also, or a central medicine store called Joint Medical Stores. So that was where initially Rx solution was working properly. And after that was demonstrated, then the public sector, it was easier to them to adapt to it. So it started with a pilot in the public sector, at national level, regional level, and district level hospitals, 3 of them, and that was moving a bit slow. And then it was introduced to the private PNFP, private not-for-profit sector, which was then very successful, and then it rolled back to the public sector again. So there was a lot of ping pong between the sectors in Uganda.
And maybe one other example, we have been doing a lot of work with sort of private drug sellers, very small scale distributors of drugs in Tanzania called ADOs, and have developed and piloted a tablet-based application called PointMed that enables basically them to keep track of their business, what they're earning, helps propose reorder levels, and they can even keep track of patients. A fairly simple tool, one that we haven't got a future roadmap for yet, but certainly the folks in Tanzania that used it found it very, very helpful. And I think that's certainly the future, particularly at the village level. Maybe Dean, you could go ahead and answer the next question in the chat there. Does Rx Solution have the ability for accepting e-prescriptions from an EMR?
Yes, it does. At the moment, we do import and export, but obviously any sharing of electronic medical records would require a common understanding or a common format. As long as the two systems understand the common format, importing would be no problem. So yeah, that's not a problem.
Okay, and another question for you. How does Rx Solution handle the stock taking processes?
Okay, that's an interesting question. So what we've got with stock taking, obviously you can't shut a facility down always for a day or 2 days to do a lot of stock taking. So what we do in Rx Solution is we allow you to do stock takes by bin. We allow you to do stock takes in the whole store, or you can divide it up as you wish. All it will do then, it will make sure that you've processed all of your current requests, and there's nothing on hold. And then it will allow you to process your stock taking, as I say, either per bin or per aisle, or however you want to configure it. So yes, stock taking is highly configurable as well.
Great. Are there any other questions? Looks like we've gone through those that have been contributed.
Randy, there is a question in the question answer box. Somebody is asking,
Oh,
Dean, this might be for you, does RX Solution have an API to extract data, even though the standard coding based on FHIR or ICD-10 are not integrated within the system?
So yeah, so we've based the API on a standard set of requirements here in South Africa. So we haven't based it on FHIR at all, but it is planning on the plans in South Africa are to make it FHIR enabled. So yes, that will be a future one, but it doesn't matter for the RX Solution scenario. RX Solution can do the transformation of the data into a FHIR compatible or HL7 compatible format. So the API itself is not FHIR, no.
great. I see one more from Mohammed Kibria. As you will be focusing on the sustainability of RX Solutions, what are the challenges you are envisioning to engage the private sector in this effort?
At this stage, the private sector where we are uses their own system. They use their own coding system, and the public sector uses a different coding system. At this stage, there's no plans for the private sector to adopt RX Solution, but with South Africa moving at some point to an NHI, there will probably be a need for a shared platform at some point. But at this point, the private sector does not use RX Solution.
And again, in Uganda, it's slightly different, and they are working on using the same code and building a national catalog of all the product codes, which was it's something I was working on when I was based in Uganda on having these two different catalogs and trying to merge them. So we eventually can aggregate data across the two sectors, private and public.
I was wondering maybe if Mohammed's question was a little more in the line of engaging the private sector to actually support the software in terms of its user support or further development.
In that context, but budget has always been a problem for public sector. They struggle to get budget to do this kind of thing here in South Africa. So getting private sector support does require a large amount of money, and that's not happening at the moment. So they are going along with their own in-house systems and support at this point in time. However, I don't think that's a sustainable long-term, and there will need to be a private sector integration or some form of external party assisting with RX Solution and its support and moving forward, as well as with any other tools that we have. So in that context, probably in the future, we will be looking at something in that context.
Randy, to add to that, I think one of the approaches that we have used is to, whilst setting up and deploying these solutions, looking within the private sector to see whether there are providers within the country that can be trained on their solutions to be able to provide the support post-project, so that we have the local capacity. We're working in Philippines now, actually working with the IT department of the government, just to ensure that they understand the system and have the capacity. And one of the approaches we're using is also to identify local organizations that have the capacity to be able to do that. That was an approach we actually tried in Bangladesh, and we are building on in other countries. that then would make sure that it is sustainable and there's capacity in country to continue managing the products that are deployed. Thank you.
Excellent. Thanks a lot.
Maybe I can also
There's
add to that one.
one more question. Kim? Yep, please go ahead, Kim.
Yeah, no, in Uganda, initially the project, MSH project, was working in 45 districts out of the 112 back then. But then eventually, after it became a national intervention, of course, then we had to reach out to other implementing partners and organizations. So right now, and that's why it became a national sustainable solution, because it's not depending on one organization anymore. Ministry has taken the lead and made it an official intervention, national level. So then you build a big group across the sector within both pharmaceutical expertise and IT expertise to make sure that that you can support all the needs of the given software solution. In this case, it was RX solution. But it's one of the key elements for the sustainability, I would say, and to reach critical mass in the rollout, national scale-up in Uganda, was to build this collaboration between all the different stakeholders for this purpose. Thank you.
Great, thanks a lot. And we are approaching the end of the hour. There's one more question from Mohammed that I hesitate to ask because it could take a long time to answer, but I will anyway. I think probably Dean should answer this. Would you explain the Bayesian analysis that you have integrated into the RX solutions?
Oh, that is a complex question. I'm not a Bayesian mathematician or a statistician. So that code was built in based on confidence intervals. So we can do confidence intervals, etc. Forecasting, complex forecasting on any particular product. So we do use statistical analysis, Bayesian analysis, which is a standard statistical way of doing things. So probably that's the short answer. But yeah, we do have a lot of different variables we use in that calculation. Also, the calculation is based on consumption and how much consumption we've used, and it's also based on peaks and troughs of consumption, and it does evaluate it in that context. Thank you.
And just before I hand it back to Christina, she's also asked, is there a place where we could find a roadmap for new or updated functionality for RX solution? It doesn't appear to be on GitHub. Is that something we're working on and not yet published?
I think that's something we're still working on.
Okay, great. Good. All right. With that, I want to thank all the panelists for a very interesting discussion. And I'd love to hand this back over to Christina. Thanks so much for hosting us.
Great. Thank you, Randy. Thank you, Kim. Thank you, Kofi and Dean, and Javier for this presentation. I think I've learned a lot about what is entailed in pharmaceutical systems. You've definitely expanded my knowledge of the regulatory environment, which is quite complicated. So it's really exciting to see these tools that you guys are working on. I think this is a great kind of framework and foundation for moving this work forward. So we really appreciate you all taking the time to be here with us today and share your experiences and expertise in this area. And I want to thank all the attendees for your questions and for being here with us today. And I did put in the chat the link to sign up for the Global Digital Health Listserv in case you're interested in joining the network, so you can get notices about future webinars like this, and also be able to reach out to the over 4,000 member listserv about questions you may have in digital health. And we will be posting the recording of this webinar afterwards, so you can share with colleagues who may not have been able to make today's session. So with that, I will close today's session, and thank you again to MSH for hosting, and I hope everybody has a great rest of your day. Thank you.
Thanks a lot. Bye-bye.
Bye.